This is our COVID 19 and vaccine update. Doctors, please proceed. Thank you.
Good afternoon, everyone. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Last week, I spoke about how public health is shifting to mitigating the risks of COVID-19. And for some, that may have felt like a sudden shift of our approach. Even though this virus has changed quite significantly, that doesn't mean that all the work we've put in the last 2 years has been in vain. I want to thank Manitobans for stepping up to the challenge time and time again, and we've been asked to step up yet again because of the nature of this virus. So this virus has changed dramatically, so we need to change. One of those things is our approach to contact tracing. With a virus that is so much more infectious, with such a shorter incubation period, our typical approach to contact tracing would not be nearly as effective. So we do need to change our approach to that. So it is a change and sometimes difficult to accept those changes, but it is really the nature of the virus that has made us change the way we approach our response. You'll also notice that our daily case numbers are changing the way we report those. Today, that number of daily cases is 919. Last Wednesday, it was 1,478. The Wednesday before that, 1,790. So this may give that impression of a peak and now a downward transition, but that's not something we can rely on. These reporting changes are really a change in our testing strategy. So we know we have eligibility criteria for those who can receive PCR testing. Many are undergoing rapid antigen testing, many doing that at home, where these positives are not reported to public health and thus not taken in consideration in these daily case numbers. So certainly a proportion of those who are testing positive with rapid antigen are getting confirmatory PCR tests. So some of those are reported, but certainly not all of them. The medically supervised rapid antigen tests are being counted in our positive case numbers, but those self-administered tests are not. So we certainly are seeing that we're well within the midst of that Omicron wave. We cannot rely on our numbers being in a decline at this point just because of our confirmed numbers are declining. So we're seeing a significant amount of transmission of that virus currently. And so we all still have to be very cautious with our contacts. So for the past 2 years, we've been familiar with seeing that COVID information in certain ways. And certainly our online data has shifted to provide the number of vaccine doses received by Manitobans. We want Manitobans to know that how we're doing, but also want to encourage you to get vaccinated. Vaccine is still our best defense against Omicron and COVID-19. It still provides tremendous protection against severe outcomes. So that the importance of vaccination cannot be overstated. So whichever dose of vaccine you're eligible for, please get that as soon as you become eligible for it. And just looking at some of the numbers to support that. So you're 3 times more likely to be hospitalized with COVID-19 if you're not vaccinated. You're 11 times more likely to be admitted to an ICU with COVID-19 if you're not fully vaccinated. You're 10 times more likely to die with COVID-19 if you're not fully vaccinated. So it's quite clear that vaccine still provides a tremendous benefit to Manitobans. And I encourage all Manitobans to get whatever dose you're eligible for as soon as possible. So, of course, we've come to know the fundamentals quite well. And so those are other things that are in that toolbox that we still have: wearing a properly fitted, high quality mask, physical distancing, hand hygiene, staying home when ill. These are all very important things, and they continue to be important as we deal with Omicron. So even mild respiratory symptoms, we need Manitobans to stay home, get tested, especially if you're at increased risk. But at that early sign of even mild illness, we need Manitobans to stay home. So close monitoring for every one of those symptoms, isolating and testing as soon as appropriate. Notify those contacts, and we want them to be extra vigilant, although everyone should be quite vigilant right now in monitoring for symptoms. So of course, we're all tired of this, but we still have a lot of work to do to help mitigate the effects of this virus. So on Monday, Health Canada announced the approval of oral antiviral Paxlovid as an additional treatment option for COVID-19. So this is yet another welcome tool to our toolbox to mitigate the risk of COVID-19. Manitoba has been allocated an initial supply of 1,100 doses, and we're awaiting a delivery on that. Additional doses have been requested. Eligibility for treatment will be based on risk of becoming severely ill. And again, the purpose of this is to decrease that strain on the healthcare system. So eligibility quite similar to the eligibility for the monoclonal antibody treatment that's already been available. So a positive COVID-19 test needs to be confirmed. So eligible individuals who test positive on a self-administered rapid antigen test can be referred for an assessment with a repeat confirmatory rapid test done by a healthcare provider at the time of assessment. So treatment must be administered within 5 days of symptom onset with Paxlovid. So this makes it even more important, especially if you're at high risk, of close monitoring symptoms and early testing as soon as those mild symptoms develop, because we do have a short time window related to the effectiveness of this medication. So Manitobans with symptoms of COVID-19 are encouraged to seek that immediate testing, to ensure that they will be eligible for treatment. Once that referral is made, the prescribing physician will review the individual's medical history, medications, when their symptoms started, to determine if treatment is appropriate for them. Treatment information, options, eligibility criteria for monoclonal antibody treatments available on the Manitoba Health website. Information regarding oral antiviral treatment will be added online as soon as that becomes available. I want to remind Manitobans that appointments are available at the 820 Taylor Avenue location for rapid antigen test pickup. You need to be eligible for tests, which means you need to be age 5 or older with symptoms of COVID-19, or be a asymptomatic household contact who is exempt from self-isolation, or be advised by public health officials that you need to take a rapid antigen test. So individuals who are not eligible will be turned away. So clients are encouraged to bring proof of booking confirmation via digital or paper copy. Appointments can be confirmed on site if needed. Someone can pick up your rapid antigen test for you if needed, as long as you have an appointment, and appointments can be booked online. So thanks again to all Manitobans. I'm going to pass over to Dr. Reimer.
Thank you, Dr. Rusin. Good afternoon. I'm Dr. Joss Reimer, medical lead on Manitoba's Vaccine Implementation Task Force. As Dr. Rusin expressed, Omicron's spread is extensive. By now, most people probably know someone, or maybe even several people, who have contracted the virus. With kids return to school this week, the most important thing that parents and caregivers can do right now to help slow the spread of Omicron and to protect their kids is to ensure that they are vaccinated with their first dose if they're age 5 to 11, and for older children aged 12 to 17, that they received their first and second doses. If you have a child who is not yet vaccinated, schools across the province are now continuing the in-school and after-school vaccine clinics. Parents will receive consent forms and information from the school to communicate the schedule and ensure that your child is prepared for vaccination. Participating in the school's COVID-19 vaccine program is a convenient way to take that next step to protect your child, their friends, families, and the whole community. You can also go with your child after school if you have not yet received your first, second, or booster dose to recharge your own immunity. No appointment is needed for these after-school clinics, so it's convenient and it's close to your home. Delivering the second round of vaccines to children aged 5 to 11 gets underway this week. So if your child was immunized against COVID-19 8 weeks ago, when the available for this age group, it is now time for their second dose. It's recommended by Health Canada, the National Advisory Committee on Immunization, and Public Health that the second dose be administered. And both NACI and Manitoba's Pediatric Vaccine Advisory Committee recommend that that second dose occur at the 8-week mark. As well, I just wanted to highlight that this week in Winnipeg, the RBC Convention Center Vaccine Clinic is restarting the opportunity for walk-in appointments as of tomorrow. So this is a good opportunity for the whole family to go and get your first, second, and third doses together. Just please make sure that you bring your Manitoba Health Card when you do go. I wanted to again discuss the importance of booster doses. Boosters will maximize your personal protection and give our health system a chance to recover somewhat from the burden that it's under. The booster dose is readily available to all who are eligible. So that's everyone over the age of 18 in Manitoba who are 6 months from their second dose. But it's most important for people who are over 50 to get immunized with a third dose right away, because this group is experiencing and will continue to experience more severe outcomes, including hospitalization, ICU admission, and deaths. Right now, about 92% of Manitobans over age 50 have received one dose of the COVID-19 vaccine, and about 90% have had 2 doses. And that's great news. But we are still seeing a significant gap when we talk about third doses, with less than 61% of Manitobans over the age of 50 currently protected by a booster. So we really want to do better here. We have to act quickly to get that extra protection to Manitobans who are most at risk. The groups that I'm most concerned about right now are people in their 50s and 60s. We've seen pretty good uptake in the 70+ population for booster doses, but almost half of all people aged 50 to 69 who are due for a booster have not yet received it. I know that many people in this age group are healthy, living productive, vibrant lives in the community, so it can be very easy to not feel worried about the severe outcomes related to COVID. But we really can't ignore what we're seeing in the hospitals. Once you hit the age of 50, your risk of severe COVID goes up substantially. And it takes an even sharper increase after age 60. So please, if you are over the age of 50, get your booster as soon as you're eligible. There are also many health conditions that will put you at higher risk of being hospitalized if you get infected. If you are a person with diabetes, for example, you're at much higher risk for experiencing severe outcomes, including hospitalization and death. So we are urging all Manitobans who have diabetes to schedule their next dose immediately. If you have diabetes, you're over the age of 18, the booster dose is incredibly important for your protection. I really want Manitobans to think about the medications that they take regularly, or think about the things that they see a doctor for. If you have any of the health conditions on our list, and many of us do, whether that's heart disease or COPD or kidney disease, liver disease, cancer, and so forth, please get your booster as soon as you're eligible. Other groups of people at higher risk are those who live in a First Nations community and those who are moderately to severely immunocompromised. a complete listing of the medical conditions that would classify you as immunocompromised, as well as a list of conditions that put you at higher risk of needing hospital care, can be found at protectmb.ca. If you are still feeling unsure about being vaccinated against COVID-19 and you have not yet received a first, second, or third dose, please contact your doctor this week. Make an appointment to discuss your concerns and receive their recommendation based on your personal circumstances. We know that 2 doses of the vaccine provide a lower level of protection against mild infection with Omicron than against previous variants. As researchers race to understand the Omicron variant and to anticipate its next moves, it is proving to be difficult. From its genetic origins to the way it infects people, Omicron is unique and it is challenging. What we know right now about the vaccines and how they interact with Omicron is that a third dose prevents Omicron infection about 55% better than having 2 doses. We reported to Manitobans last week that people who are unvaccinated are 139 times more likely to have a severe enough infection that they require ICU admission compared to someone who's had a booster dose. As someone who has worked in ICUs, I can tell you that an ICU admission is frightening, and it is both physically and mentally traumatic for people to go through, and it's traumatic for their loved ones as well. Many people come out of the ICU with chronic and ongoing health challenges. It really is a harrowing experience that can be prevented in many cases by taking the protective measure of ensuring that you are fully vaccinated and had your booster. So today I want to expand who we're talking to and ask Manitobans who have people in your life who are over the age of 50, or people in your life who have some of these medical conditions like diabetes, COPD, coronary artery disease, kidney disease, liver disease, or any other condition on our high-risk list. Please reach out and support your family member or your friend by asking them to get vaccinated, to get their next dose, or to get a booster. Literally, this decision can make the difference between life and near death, and sometimes worse. Maybe you can give them a ride to a vaccine clinic, or help set up an appointment, or go with them to their local pharmacy. There is no more critical time than today to reach out and see what you can do to help protect your loved ones who are over the age of 50. I'd like to spend today a few minutes highlighting some of the latest biomedical research on COVID-19 and how vaccines prevent against some of the outcomes. I really want to spend some time looking at the research to underscore the critical importance of doing everything that you can to protect yourself through vaccination. So one big question that continues to be researched is, how does mild or serious COVID-19 affect the brain? In one study that I read recently from Cold Spring Harbor in New York, of the 185 million documented COVID-19 cases around the world, neurological symptoms, including persistent cognitive impairment, were shown to affect about 1 in 4 people who have had COVID. So that's 25% of survivors. That's a really alarming finding. And while it is more common in people who experienced severe COVID that required hospitalization, even those with mild symptoms still experienced higher rates of lasting cognitive dysfunction in the study. So when I say cognitive dysfunction, I mean that a person has persistent concentration difficulties, has problems with verbal or nonverbal learning, has short-term or working memory loss, and many other symptoms related to the brain, all of which can significantly affect their daily life at home, at school, and at work. The long COVID cognitive syndrome is similar to the impairment that's experienced by some people who have gone through chemotherapy, which is known as chemofog. In this particular study, the researchers refer to chemofog COVID fog, which features increased rates of anxiety, depression, disordered sleep, and fatigue, along with the other cognitive impairments that I mentioned. Some other recent scientific findings demonstrated a link between having severe COVID-19 that required hospitalization and having a neuroinflammatory response. That means swelling of brain tissues. And this might explain how COVID fog happens. We can all do our part to prevent the long-term symptoms associated with long COVID by protecting ourselves to the fullest extent possible, so that even if COVID-19 is contracted, the chances are significantly better for most people that it will be mild and not long-lasting. That actually leads me to one of the most interesting new studies to come out recently. A study from Israel looked at the effects of vaccine on long COVID. So long COVID is the term used to describe symptoms that do not fully recover for weeks or even months following infection. So it includes COVID fog, but also could include symptoms like shortness of breath or fatigue. Until now, there was very little data available on how vaccination might impact the risks of long COVID if someone was infected after being vaccinated. This Israel study included 951 infected people and 2,437 uninfected individuals. The researchers found that the risk of long-lasting COVID symptoms was significantly lower after an infection in a vaccinated person compared to an infection in someone who is unvaccinated. In fact, it was so much lower that it actually took people back down to baseline, meaning that people who were vaccinated and had an infection, their risks of reporting long-lasting symptoms were the same as people who were never infected in the first place. This is the first study I've seen on this topic, and while it's very encouraging, we will need to see more research before we can definitively say that the vaccine is strongly protective against long COVID. I would also like today to talk a little bit about the effects of vaccination on the menstrual cycle. This topic has been widely circulated with anecdotal reports on social media, and some women have expressed fears that getting vaccinated could affect their menstrual cycles going forward. Because it is so common to have menstrual irregularities, it's been very difficult to determine if indeed the vaccine was linked to these reports. But a new study came out last week looking at the potential effects of the COVID-19 vaccines on menstrual cycles that included 4,000 individuals. 2,403 were vaccinated and 1,556 were unvaccinated. The studies compared their menstrual cycle lengths in the cycles immediately after vaccination with their baseline average over 3 pre-vaccination cycles. Having that baseline information about the 3 pre-vaccine cycles was critical. The researchers worked with women who are already using a menstrual cycle tracker app, so they were already paying close attention to the length of their cycles. So this allowed the researchers to look back and compare the post-vaccine cycles to the pre-vaccine cycles. The research found that there was no significant change in the menstrual cycle over the 6 cycles that they studied for people who were not vaccinated. They also did not find any statistically significant difference in the number of people who experienced a big change in cycle length, comparing those vaccinated to unvaccinated after dose 1. But what the study did pick up was that people who received both doses close together during the same menstrual cycle reported an average 2-day delay in the start of their next period after dose 2. This is the first study to demonstrate this effect. Thankfully, this difference was also found to be temporary. It resolved for all of these individuals by their 3rd post-vaccine menstrual cycle. Here in Manitoba, since most people had their 2nd dose more than 4 weeks after dose 1, this is extra reassuring. We had very few individuals that could have received 2 doses within the same menstrual cycle. In the initial trials by the manufacturers, where they evaluated the safety and risk of the vaccines, menstrual changes were not studied. And in fact, they're often not studied in research for many topics. So this new research is really important for women's health. I should also point out that the study did not find any changes in the length of bleeding, regardless of whether or not somebody was vaccinated. I also should point out that separate from this study, multiple studies have shown that even with this temporary change for some people who received 2 doses in the same cycle, none of the other studies have shown that vaccines impact fertility. I have a quick update for parents of 12 to 17-year-olds who are waiting on word about when their child will become eligible for a booster dose. Public Health is still waiting on a recommendation from the National Advisory Committee on Immunization, or NACI, on whether or not a booster is beneficial for this age group. I know that they continue to look at this and they're evaluating the science around whether or not a booster would be beneficial to teens. And as soon as we have a recommendation from them, I will share that with Manitobans. So with that, thank you so much for listening, and we can now take your questions.
Thank you, doctors. A reminder to our reporters on the line, you will have 1 preliminary and 1 follow-up question. Up first this afternoon from CHVN, Taylor.
Hi, good afternoon. Dr. Ruslan, can you give us an idea of how many of those self-administered rapid tests, done at home you think are turning up positive each day?
Well, it's a difficult question to know. We know that the reported number of cases is a vast underestimate for a number of reasons. We know that it's only a fraction of positive tests. We know that a certain proportion of the many at-home tests are coming back positive, and we know that there's just like in other waves, there's a significant proportion of Manitobans that have symptoms that aren't attending for testing. So hard to know the precise number there. What we can say for sure is the actual number of COVID cases is much higher than the 919 that we report.
We're also seeing those number of deaths rise quite a bit over the past week. Can you explain a little bit more about why these are quite high?
So, I mean, we do know that there's severe outcomes associated with COVID-19. So, as increasing case counts, then we're going to start seeing, unfortunately, increasing severe outcomes, hospitalizations, ICUs, and most unfortunately, deaths. So we do have a process that we review those reports. We do know that there's a lot of transmission of the virus, so we want to ensure best when we're reporting things like hospitalizations and ICUs and deaths that we are reporting numbers that are, as best we can tell, are actually attributable to the virus. So right now I don't have any further details, but it is something that we continually watch.
From the Winnipeg Free Press, Katie.
Good afternoon. Dr. Ruslan, although most provinces have shortened the isolation period required for Omicron infections, Dr. Tam said yesterday that Omicron is not infectious for a shorter amount of time compared to previous variants. So are you recommending that Manitoba change its isolation period requirements? And can you explain why or why not?
Yeah, so at this point, we're not planning on changing that. The period of infectiousness, we know, can be variable with the individual. From what we see in most circumstances, those that are vaccinated, that period of communicability is lessened, and everything is on a gradient. It's you don't just become all of a sudden less able to pass this just magically at day 5. That's why we have certain safeguards on top of this. When people are released from isolation at day 5, we want to ensure they're still wearing that medical grade mask, avoiding high risk scenarios, and be aware that risk is not zero. But when we have such widespread transmission and so many cases, so many people who will be exposed, we could see the effects on many critical services if we kept a 10-day isolation mandatory. So right now we're not reviewing, we're not going to change it. We're certainly reviewing it over time, but those are the things we have to consider.
Okay. There's very little data publicly available in Manitoba about infection rates and hospitalizations among children younger than 5. So what are we seeing now in terms of severity of infections in those very young kids? And how can parents and daycares properly assess the risk?
So we know that all along the risk of severe outcome in our younger Manitobans has always been significantly less than older Manitobans. And that includes things like hospitalization and ICU admission. So we know that risk is much lower. We know that vaccine is now available to children older than 5. And we still have a number of the methods in our toolbox to still help with reducing the transmission. Hand washing, appropriate masking, physical distancing. We have public health orders in place. So again, the risk overall is lower. It's certainly not zero. So we do need to be always cautious. But our hospital numbers, we can get details from Shared Health, but we've seen throughout this pandemic that the risk of severe outcomes in younger Manitobans is much less than others.
From Global News, Marnie.
Hi, Dr. Roussin, with more and more people testing positive for COVID, there's more discussion about immunity after infection, with some people, I guess, maybe thinking if you test positive, you can maybe get back to normal somewhat. What level of immunity do you have after testing positive, and for how long do you have it?
And so again, with this, we're still learning about this. Omicron is relatively new, so we're still going to have to learn about things like the immunity, the degree and duration of that immunity. From prior infections, we were looking at the evidence that suggested that at least 180 days of protection from prior infection. Again, nothing is absolute. But it's very, very likely that there will be a level of immunity gained from following infection.
Thanks for that. And we've been asking for modeling updates for a while now. When might we see this, or do you know when this wave will peak? And are changes in how we're tracking cases kind of hindering our ability to gauge that?
So that does add a level of complexity to things like modeling and predicting when things will peak, just because it's harder to know the magnitude of infection right now for various reasons, just how infectious this is, how much more transmissible, as well as limitations in being able to test everyone who's symptomatic. So as far as modeling goes, I don't know. I don't have an update on that. I can't comment on when that would be further shared. And as far as that peak goes, I don't have a definitive answer on that. It's something that we're actively monitoring.
From the Brandon Sun, Karen.
Good afternoon, everyone. Just getting back to the higher death and hospital rates. Now, in the past, it used to be, higher deaths and hospitalizations were a lagging indicator of a peak that has passed. But again, we say that we really have peaked or passed a peak, considering the difficulty it is at tracking these infections.
So I mean, we can't really say that we've peaked at this point. Again, it's something that we're watching closely. You're right; things like hospitalizations and these severe outcomes are lagging indicators. So even if we see a peak relatively soon, we're going to still see climbing cases in hospitals, because that's a lagging indicator. So we'll have to be watching all of those indicators to try to better inform our current status.
Okay, thanks for that. And this is more a research question. I was just reading something about some vaccines are looking at maybe targeting the DNA within the COVID virus rather than the spike protein, because the DNA inside replicates slower. Has there been any updates on your end on whether or not this is going to factor into future plans for vaccines?
Well, what I would say is that vaccine production is always trying to find the parts of the virus that are the most common to all variants. So that's true whether we're talking about influenza or COVID, that the manufacturers want to try to find parts of the virus that they can target that don't change very much from variant to variant. And I know that that work is ongoing when it comes to COVID as well. But I don't believe that there's any manufacturers that are close to finalizing a product that would be targeting anything other than the spike protein. However, with there being so many companies and so many scientists around the world working on this at the same time, we certainly could see new vaccines that target different parts of the COVID virus in the future, and we would welcome something that is more effective against a larger variety of future variants.
Okay, thank you.
From CJOB, Clay. From CJOB, Clay.
Yes. Hello. Can you hear me?
Please proceed.
Oh, I can't hear you now, Clay.
Okay. We're going to try this one more time. Can you hear me now?
Go ahead.
Yeah.
All right. Dr. Reimer, you just mentioned other variants. Is it reasonable to think there may be more variants coming down the pike once the Omicron variant is brought under control?
Yeah, I would say that's very reasonable to think. This virus has shown that it is effective at changing and evolving over time. We didn't anticipate the Omicron variant. I think most researchers expected that the next variant would be something more similar to Delta and would have been a variation off of the Delta variant. But Omicron actually seemed to have developed from the original strain as opposed to from Delta, and so caught a lot of scientists off guard because it came from that different strain than what we were expecting. So this virus has demonstrated that it can change over time, and I expect that it will continue to do that. The question really is what the next variant looks like, whether it will be even more transmissible, or would it be more severe, or will it have more of an impact on the vaccine effectiveness? And we don't know that at this point. But what we do know is that so far, even though Omicron looks quite different from previous variants, that these vaccines are still able to produce an immune response that can recognize it and prevent it from leading to those severe outcomes. So while the vaccines are not as effective at stopping the virus from entering the body, once it's in the body, your T cells are really good at targeting cells that have the virus and getting rid of it before it can really dig in deep and cause some of the stress on the body that we're seeing in people who end up in the hospital. So the most likely would be that future variants, it would continue to be effective against severe outcomes. But of course, like I said, we didn't predict this variant. So we know that we need to be ready to respond to whatever comes next.
Thank you, Dr. Reimer. Dr. Roussin, is there a certain way the province classifies COVID deaths? For example, someone comes in with a severe heart attack. They're checked out, and it turns out they're positive for COVID-19, and they eventually die. You know where I'm coming from on this?
Yeah, and so this is a challenge with the desire to be reporting things quite quickly. Then it often you've seen us adjust some of our statistics related to severe outcomes in many ways as we go back and review. So typically the reports are trying to decipher Manitobans that have died due to COVID-19 rather than just having tested positive and died of other causes. And so it can be challenging, especially in an environment where this sort of information is shared in a very quick manner.
Thank you.
From the Winnipeg Sun, Ryan.
Hi, this is a question for Dr. Roussin, I guess. Just in terms of restrictions, which way is the province leaning towards right now? More or less? What's kind of being discussed right now?
Our public health approach is discussed and reviewed at many different tables continuously. And so things like public health measures, our approach to contact tracing, testing, all of these things are discussed frequently at many tables. So, when we make decisions and have an approach that we're going to change, then we announce that. So, right now I don't have any details to share on that.
Okay, thanks. And you talk about the effectiveness of a third dose of the vaccine. Would the province ever consider maybe having people be considered fully vaccinated to have 3 doses rather than 2?
I can start, and if Dr. Roussin wants to add anything. But we've definitely talked about this along with many other options to consider. Right now, as we're just learning about Omicron and how well the boosters work against infection and severe outcomes, I think there's still a lot of knowledge that needs to be developed before we would feel that it's a reasonable restriction or expectation to put on Manitobans. So that's not to say that this couldn't be something that we move to in the future, but we want to make sure that we have really solid science before we include additional restrictions on Manitobans. And I think there's still a lot to learn about the booster and how long it works, for example, to protect people against infection with this current variant.
From CBC Radio Canada, Julien.
Good afternoon. Dr. Roussin, could you clarify the process to get the Paxlovid medication? To what I understand, we will have, or we maybe already have 1,100 doses. We'll have to get a positive test and a medical review. But I'm wondering who will be in charge of that medical review?
Yeah, so we don't have any doses in jurisdiction as of this morning. So we are expecting it shortly. And so, yes, so there will be an online process for people to follow. And those with either a PCR test will be able to self-refer through a form, which will be reviewed by a medical practitioner. And then arrangements made for dispensing that medication if appropriate. So those with a rapid test, there'll be a process to have that confirmed as well. Of course, a PCR test could always be used. And so there will be a clear process online. And we really need to ensure people are being tested at the first signs of illness, especially if they're high risk, so that we can get that medication in their hands in that very short window.
Thank you. And Dr. Reimer, you talked about the importance of the third dose. I'm just wondering when people 12 and older will be able to get the third dose.
The National Advisory Committee on Immunization is looking at that right now. So they're evaluating the trials that we have from real world to see whether or not a booster would actually be beneficial for that age group. Now, they're already at lower risk of severe outcomes. And so we're going to wait for NACI's advice on whether or not a booster substantially increases the protection in this age group or not before we move forward. So I don't have an exact timeline because we are waiting for NACI, but I am told that they are reviewing it in January.
Thank you.
From CBC Manitoba, Ian.
Good afternoon, Dr. Roussin. There are 2 pediatric ICU cases in hospitals right now. What can you say to ensure parents that we have enough ICU capacity for young people?
So we know that any severe outcomes at all are obviously tragic, and our hearts go out to the client and the families with that. And so, as far as capacity goes, we do know that the risk in younger Manitobans is much lower than that of others. We don't see nearly the same proportion of cases ending up in hospital with that. So as far as a question about capacity and anything like that, that should be directed to Shared Health.
Thank you. And we are now in our 3rd day of in-person learning for most kids. What are you hearing from schools? Are you concerned about levels of absenteeism? Basically, just what are you hearing from our schools?
So it's early on, and so we're keeping close tabs, and of course we've always been in close contact with our partners in education. So I don't have any significant details at this point. I think everyone's really stepped up to make this as safe as possible to have the kids back in school. And I think we're going to do whatever we can to have the kids remain in school for as long as we can.
From the Canadian Press, Steve. From the Canadian Press, Steve.
Well, hi there. Dr. Roussin, I know you said earlier that it's a bit too early to declare whether we're at the peak or near the peak, but are you seeing some, maybe encouraging is too strong a word, but some signs that the situation may be easing somewhat in terms of the overall ICU numbers, the testing percentage, and the number of people going in for tests?
Yeah, so it's a little early to consider that. I don't think there's. We've seen some dropping of the test positivity over the last little bit again, but that's in the context of a changed testing approach. So looking at other jurisdictions and when it started there and here, it would be reasonable to expect that peak in the near future if we maintain the same trajectory as other regions. But right now, I can't point to any specifics in our data that suggests that we have reached that.
Okay, and I know this is obviously much more difficult with the change in contact tracing procedures, but of this most recent wave, have you been able to detect a pattern as to where the transmission has come from? It was over the holidays. Was it in-person gatherings in homes? Was it in public gatherings elsewhere? Do you have any indications on that front?
So like you said, with the way we've had to change our approach to contact tracing, that type of information is more difficult. What we know is that this virus is so much more infectious than Delta. And it's transmitted in much the same manner, with indoor contact being that way it's transmitted. So we just know if you are in the community and in contact, especially in indoor prolonged contact, it's very likely that you could be exposed to this virus. And so it's really difficult to distinguish. I don't think we can distinguish indoor prolonged contacts going to spread this virus.
From CTV Winnipeg, Michael.
Hi, all. Dr. Rusin, just on the potential peak, and I know you said multiple times that it's too early to say. I'm wondering, given the fact that we've changed our testing strategy, and the number of confirmed cases isn't necessarily a very reliable metric right now to let us know if and when we may be at a peak, would hospitalizations be the best indicator going forward?
So, I mean, this is certainly going to be, our most important indicator. That's what, all of our public health approach really is to try to decrease the burden on the healthcare system. The issue with using as an indicator is that it's a lagging one. So if we start seeing what appears to be a peak in hospital admissions, and we know we probably peaked weeks before that in community transmission. And so there's a number of things we look at. Once things stabilize with our testing change, then things like test positivity over time may become useful again. We could look at absenteeism rates in the healthcare system, in education, and other settings to help guide some of this as well. So we're certainly not blind with what's going on. It just our approach has to change due to our change in contact tracing and our testing strategy.
And going to talk more about the peak, and we've seen in other jurisdictions, as you mentioned, a pretty sharp drop in case rates after we've reached the peak. It's happening now in Connecticut and New York. We've also obviously seen it in South Africa. Was that part of the province's planning when it came to implementing restrictions? The fact that it was generally maybe understood that, we would hit a very large peak, but then a rapid decline?
That really couldn't come into our planning. We couldn't rely on that. We knew that there's a significant amount of transmission that goes on with Omicron. We know that it is less severe, but there's just the sheer numbers that we would see would sure put that strain on the healthcare system. So we couldn't really rely on something like you're describing there. So that wasn't really part of any of our thought process on how we're responding.
We have time for just a couple more questions. Please proceed.
I just had one in terms of the booster being given out right now. So when I received mine, I was told that it was a half dose. So I'm just wondering, is this a change from the first 2 doses? Because as far as I know, that the first 2 I received were considered full doses.
Yeah, so that would be referring to Moderna. With Pfizer, there's only 1 dose that's provided, but Moderna applied to Health Canada for a half dose for their boosters. Now, the half dose of Moderna still actually contains more messenger RNA than Pfizer's full dose does. But their plan with that was that it would still provide that robust immune response, but hopefully have fewer side effects compared to the full dose. So Manitoba, much like the rest of the country, is using the half dose for most people. However, NACI did review and said that for people who are over the age of 70 or are immunocompromised, that they should continue to receive the 100 microgram or the full dose of Moderna, even if it's their booster dose.
Dr. Rusin, what gives you the confidence that the restrictions we have in place now are enough?
So it really comes down to continue to follow where we're at. We know that we see transmission patterns in other jurisdictions. We're seeing what we are dealing with here right now, and then of course following what's most important is that strain on the healthcare system and ability of the healthcare system to respond to these cases. So it's not about a stationary level of confidence. It's we follow the data and continually reevaluate our response.
Any final questions? Well, thank you, everyone. Thank you, doctors. This concludes our Zoom session.